brother's chainsaw, so whilst you hammer,
You are chainsawing.
there's conversation. I mean, I think sometime last year, this was on the table again. You know, we had a conversation around that.
Yes.
You know,
Yeah.
if you remember.
Yeah.
And I don't know.
Because it looks like the cases keep on increasing.
Exactly, you
Yeah.
know. So it's as though we talk about it, but I don't know what's happening.
Yeah.
But maybe Doc can let us know why we keep talking about it. We keep creating the awareness. Maybe we're not doing enough.
Right.
But, you know, why are the cases still going up? They don't reduce.
Okay, so the truth is, the more you're screening, the more you're detecting the condition, and so would have an increase record in the number of cases associated with cervical cancer.
Okay.
So we are having an increase in the number because we are doing active screening.
Okay.
We are doing massive educations like what you're doing with your platform. We are going to the districts, we are going to the communities to educate the young ones and even the older ones about cervical cancer. So now more women are getting informed, they are getting empowered, and they are reporting to the hospital to be tested for cervical cancer. So that's the reason why we're having more.
Yeah. Because, I mean, it also means that we're getting more treated.
We're getting more, not treated persons, but we're having more people being aware and informed as compared to probably 5 or 10 years ago.
Okay. All right.
So that is what is causing the increment in the cases.
In the number of
because
cases,
initially, it was like a lot of women didn't
know about it,
but then now that the awareness is going out there, they are recording a lot of cases. Okay, so Doc, I mean, when I was reading a little bit about, like I mentioned earlier, women ages 15 years going up, you are prone to having cervical cancer. What exactly, you would think that, oh, a 15-year-old, a 16-year-old, I mean, what could possibly make you prone to having cervical cancer? So I want you to run us through what cervical cancer is, for the sake of those who wouldn't really know, that we'll get into that.
Okay, so for starters, cervical cancer is seen only in women. Reason being that only women have cervixes. Men, unfortunately, don't have cervixes, but they are not free.
But you can ask for your girlfriend.
They are actually not free.
2024.
Which one? Okay, so I'm single again. So,
so it's found basically in only women. Like I said, reason being they have the cervixes. Now, another thing is that it's sexually transmitted. So it's not from mother to child. It's only sexually transmitted. And young girls are prone to getting it because some of them start having sex by age 9.
So that's where the men come in.
That's when the men come in.
So it means the men can also have.
Yeah, so you see, you guys don't have cervixes, but then you have a penis. So you could have penile cancer.
Okay.
So it's caused by a virus with HPV, the human papilloma virus, and it has like so many strains. We know generally, I think from studies, you have like 200 detected, but 40 can cause cancers in both men and women. For women, we know the main ones that are notorious are strains 16 and 18. But then we have other strains that could also cause cervical cancer. It's just that with studies, 16 and 18 are more notorious as compared to the other strains. Now, there are other strains that could cause cervical cancer-related conditions. That's the genital warts. I don't know if you've heard about it. So that is also caused by another strain of HPV. So it's not HPV when you're talking with respect to STIs. It's not only cervical cancer. You could have the penile cancer, you could have the genital warts, you could have the vulvar cancer, you can have the anal cancer, you could have what we call the head, neck, and throat cancers, also caused by HPV. So those who like oral sex, I know there's something called mouth dam that they use to protect themselves from getting head and neck related HPV infections.
Oh, that's protection.
There is protection.
I come so much deep. My goodness, Doc, you're the best. So we've seen doctors come here and they never say, they scare us.
That is by not to encourage you to do it. So with the young girls
when can we get that?
I'm not finding. Okay, so with young girls getting it. So from 9, like I said, these years we have as young as 9, they're sexually active. And when you're exposed to sex for a long period of time with multiple sexual partners, you are prone to getting cervical cancer. So if even you, the woman, you're faithful, but your partner is not faithful, you are still prone to getting. So it's both ways. The woman has to be faithful, the man has to be faithful. Or we educate the young ones about safe sex, or we encourage them to use protection. Or better still, abstinence. before we come to vaccination and all that. So primarily, we could do the vaccination, or we educate them about safe sexual practices, or encourage them to use protection, that's both the male, both the female condom, or as usual, you should just abstain.
I mean, this is quite alarming, you know, because like when you look at the population of Ghana, right? Like women are about 16.78 million.
Yeah.
So, and then out of that,
one.
the ages of 15 years and above are 10.6 million. So they have taken more
Yeah,
than a greater
exactly.
share.
Yeah.
And every year, you are recording close
And
to
these are the ones who actually we test. There are some who never come to that because they think it's, you know, the myth, superstitious beliefs surrounding it. So they will hardly come for us to test them. So then we could even go more than the little over 2,000 that's been recorded currently. Yeah, it's possible.
Jeez. Yeah. Okay, so Doc, you said it's sexually transmitted.
It's sexually transmitted, yes.
Yeah. Okay, so as a woman, as a young woman, as a young lady, you're 15 years and above, how best can you position?
Let's push it to 9.
To 9?
Let's push it to 9.
So
let's face reality. These things have changed. Maybe a couple of years back, we could still stick to the 15. But now young girls are having sex for whatever reasons they find themselves in. So let's not be ostriches and bury our head in the sand and say we don't see what is going on. That's the reality. The young ones are getting more and more.
It makes it easier for us to even attack well.
Exactly.
Yeah.
If you peg it only at 15,
you don't pretend.
You don't
exactly.
pretend.
You know,
Exactly.
because that's also increasing the number. Anyway.
Exactly.
So
So that doesn't have to do, the cervical cancer has nothing to do with whether you have a matured cervix or a strong cervix, because if you are younger, I believe that your cervix is not, you know...
Well mature.
Yes.
No, because you have young girls, I mean teenagers who get pregnant. Exactly. So you see, the whole thing is, the HPV has specific tissues in the body it targets. Your cervix, yes, it may be going through development, but then it's still a tissue in the body.
So it doesn't matter.
It doesn't matter.
Yeah.
It's a virus. It knows where it has to go to. So long as you have a cervix as a young woman and you're practicing illicit sex, you're not using protection, you're having multiple sexual partners, and another thing is smoking. You're smoking as a young person. You actually open yourself up for so many things.
Smoking.
Yeah.
What makes it?
Okay,
What makes it contribute?
What smoking does is that it's kind of like leads to changes in a particular cell in the body. I don't want to go into too many technicalities, but then it changes certain cells in the body. And on the cervix, you know, the cervix has an outer part and an inner part.
Okay, so we've got something on the screens. I don't know if it's represent what you're trying to let us know.
So,
so you
that's
can maybe
a normal cervix for someone who hasn't been exposed to the HPV strain that causes cervical cancer. And then when there are early stages of the cervical cancer, you can see the changes around the cervix.
Yeah.
And then when it becomes advanced, you see the changes around the cervix. But I see there's this slits. I don't know if you can see the slits, yes. So that's what is showing to me when I open a woman up and then I see. But in the womb, there's another entrance that leads into the womb. And, you know, at that side, because...
So this is just the first entrance?
This is just the first entrance.
Okay.
So let me use this in... where the river meets the sea, we call that estuary.
Yes,
right?
estuary. Yeah.
So let's say there's something like that in the woman's cervix. And around that side is where changes can occur.
Oh, okay.
So if you're... And that's where the changes is showing on the cervix, so that estuary. So if you're smoking, the cells there have that feature that could cause changes and make it easy for you to get the HPV-related infection with cervical cancer, yes. So this is just showing the stages. So the middle one, that's the early stage, you could go in to do the various procedures for managing cervical cancer. Either we'll do the freeze method or we use an electric loop to take out the abnormal cells. Then you repeat the test later to be sure that we've cleared everything. When you get to this stage, hopefully you may have finished with a family life. If not, we'll still have to go in to scrape as much as we can, and then you still have to follow through it.
It must be painful.
It can be uncomfortable.
Okay.
It can be uncomfortable. But usually I know they give some anesthesia around the area to ease the pain and everything. And then post-treatment, they'll give you medication, so you'll be fine. So then depending on where it gets to, there's also treatment for it. So it's patient selective when it comes to treatments of cervical. Let me not jump to that, but because you brought this, I just thought to add.
Yeah. So is there any situation where you get to, let's say, the early stage, and then physically your body, there are changes maybe you getting rashes or pimples? Is there anything like that?
So cervical cancer is a silent killer, like hypertension and diabetes.
Right.
It's so for people who are well, they are healthy. You don't have any medical condition, you don't have HIV, you don't have diabetes, you don't have hypertension, you're not on what we call immunosuppressive drugs like steroids, or you're not taking cancer-related drugs. Your immune system is very active. Usually, the body can fight it, so it can clear it on its own. But for some women, it's not able to clear. And I can tell that when EvaVera gets the pre-cancerous lesions, because it's in stages, it's pre-cancerous before invasive cancer. So when EvaVera gets cancerous lesions, she's safe. She may not progress to invasive cancer.
Okay.
We may not be able to tell.
Okay.
Sometimes some would give you some time. At other times, we'll just go in and go like, you know what, let's just go through with the surgical procedure and then take it off before it progresses to invasive cancer. So for so from pre-cancer to invasive cancer, you still will not get any symptoms. Very silent. Your immune system is strong, very silent. Immune system strong, 15 to 30 years, no symptoms. Immune system is poor. You're on immunosuppressive drugs. You're taking cancer-related medications. You have HIV, diabetes, hypertension. Give or take 5 to 10 years, especially those with HIV and immunosuppressive drugs. Then everything comes down. So you're good. It's going on. Just like hypertension, sorry, sometimes the only time it strikes is when people get a stroke and then you're like, oh, he was so healthy. I didn't see anything wrong with them. It's similar to cervical cancer. 15 to 30 years, if there's nothing going wrong with you, it's quiet, just there, breathing, growing. Then one day you realize that you're having this uncomfortable abdominal pain, low abdominal pain. You're bleeding after sex. You're having this offensive vaginal discharge. You maybe have some pain during urination. And then you see that there's a lot of blood coming out. You're not in your menses, but then there's a lot of bloody discharge from your vagina. You're wondering what is wrong. You go in and, oh, you have cervical cancer, maybe stage 1, stage 2, stage 3, or it's spread to other parts of your body. Now, when it spreads to other parts of your body, depending on where it gets to, it has its own symptoms. If it gets to your kidneys, you get swollen, your kidneys cannot filter the waste, then you have the consequences of it. If it gets to your brain, it's terrible. If it affects your bones, you could have weakness in your bones. Some could come down with anemia, like low blood levels. So it depends on how far it goes. It looks very quiet, but it's very terrible. And that's the reason why we are using this platform to encourage women to get screened, get vaccinated, and then get tested and treated.
What would be the first symptom that when you see you would have to rush to hospital or you have to go get tested?
Any of the 4 I mentioned. Any of them. Especially if you know you're young, well, you're a woman, not young woman, you're a woman who's been sexually active or is sexually active, you should just go. When you see any of the symptoms, you should be, you see, I tell people, it's your health.
Yeah.
Another person cannot own your health for you. So you've got to be proactive about your health. So you should make the necessary steps to get things checked. So if there's anything going wrong with you, we can detect it and then help you out.
How do men, come in this regard? Because maybe a lot of men may not know too much about this.
Right.
Yeah.
So it means that even if you're experiencing that during sexual intercourse, in your mind you think that, oh, maybe she's just in menses or bleeding or whatever it is, but you may not be able to. How do men, contribute?
So as a man, it's your partner. We are creating awareness about cervical cancer. You should encourage us to go and get tested. That's the most important thing you can, or the best thing you can do for the woman. She should get tested. She should get tested. She should get tested.
Especially when you see some of these things you've mentioned.
You shouldn't even wait to see it, because by the time you see it, it's probably gotten to an advanced stage. But if you can get in early and detect it early, we can prevent her from getting all these uncomfortable side effects. So as a man, your role, how do you come in? Be faithful.
Oh, that one is non-negotiable.
Be faithful.
So as for that one, yes. every stop laughing. It's non-negotiable. So yes, as for that,
be faithful, and then encourage her to get tested either 3 years or every 5 years. It's very important.
That's the duration.
So depending on, so I think we'll come down to screening modalities. So then I will talk about the screening modalities before I talk about the vaccination and all that.
Please help the men the more, okay?
Okay.
So
did we say we need help?
you're the one who started it, so you do need help.
I'm just caring about my
Because, you know, I know that definitely when you even listen to people's experiences when it comes to sex, these the talk shows and then all that, some naturally do complain of painful sex.
Right.
Painful sex. And so for our dear men, would you say that if you are with a partner who often complains of that, what's the probability of that not being cervical cancer?
Would have to test.
Okay.
I can't tell whether having pain during sex is related to cervical cancer. The other things that could cause pain during sex, a whole lot of things. So I can't narrow it down to just cervical cancer. That's why you have to pass through the hospital for us to be sure of what exactly is going on with you and then treat you for it. Yeah.
Because I know that there are quite a number of women who do complain of that.
Some could even have a fibroid.
Oh.
So there's so many things. Or some could even have a urinary tract infection and it comes with lower abdominal pain and they may be taking it as pain during sex. So it's not just one size fits all. There are other things that could contribute to things like that. Yeah.
Doc, we have a special request
for
you to go back to talk about the oral sex part.
Oh,
yes, properly, because
why is that supposed to be a special?
It's a special. You want it? You can't want.
Me, I'm out of coverage, so because when I wanted Doc to speak, they said, "Oh, why you are here?"
I am saying
now,
it for you. But the reason I decided to go back to it,
I was even asking of medication. They said,
I was thinking about it. I was like, KMJ, and I have asked it again for you right now. What's your problem, Dr. EvaVera?
Doc, you knew I wanted to know the medicine, right? Okay.
Oh, really?
Of course.
I know the mouth.
Man, you see, let's be honest with ourselves. There's one thing you can't stop men from doing, especially when they know whatever ethics sexually they are doing for their partners want it that way. Because you see, the point is, if you don't do it, someone else will do it for you. And it brings whatever it's going to bring in your relationship, in your marriage or whatever. We've seen married men and women who are fighting over, I'm not getting oral sex.
What at all does this do to you people? Like, I don't understand. What at all?
You see, but the unfortunate thing is that it's women who are demanding for that. So don't even say what at all is wrong with the men.
I mean,
Dog, have you not had conversations about people who are telling you their women want that?
No, I haven't yet experienced.
Oh, dog. Which people have you been talking to?
No,
not you. Let me see the kind of people she talks to. But, I mean, essentially, let's know how bad this can be and how we can manage it if we want it in a certain way, right? The oral sex.
So I don't know of centers that probably sell the mouth dams, but I know it's one way to people use it, especially in the developed countries, since they want to engage in oral sex for their sexual pleasures. But in our parts of the world, no, I haven't really come across it.
So it's something based on that you would say it's not advisable for any man to do it.
No, what if you brush your teeth before? You have a clean mouth before?
Everybody does have a clean mouth, but then they're still prone to getting the head, neck, and throat cancer related to HPV. Oh,
so it doesn't matter how well you brush your teeth and brush your tongue. Viewers,
so in essence,
viewers,
it's a no.
Yes, so the long and short is oral sex.
No, I don't do it, but I feel certain women ask men to do for them, which is something they love. So I am hoping that we'll be able to help men who are in that position.
I was about to say something, but I won't say it. I'll leave you.
Because I have tried it a couple of times, even with my girlfriend, and she said no. She doesn't want it.
I thought you said you didn't like it.
No, I said I've tried to, and the person says no. So that's a different thing.
And now, so yeah.
So man, you'll be there to me. I'm not there. Why you be there?
Okay.
If you know, somebody will do.
You know, there are some people too who wouldn't necessarily go do the only the front part.
So the back.
So the back as well. So even with the back, it's still the same thing.
As in
they do.
Oh yeah, because you see, like I said early on.
Oh, which one? I'm lost though.
Yeah.
I said early on, the HPV strains, it has specific tissues it targets. And you can get anal cancer, you can get anal warts. So if the HPV strain that causes the anal cancer or what it's there, and you decide to use your mouth to clean the place up, you're just picking it up and going to spread it.
So you can't escape it, even if you do
Front
anal
or
or vaginal, or you do
exactly
with the penis. What was it called? Penile?
penile cancer.
Right.
You're not left out.
You are not left
you're not
out.
left
So viewers, you need to watch out. Okay, just stay away from oral sex if you want to avoid all
Practice
these
safe sex.
What is even in there?
What is where? When you wanted to do it on your girlfriend, what were you looking
Because I was protecting my relationship. You have no idea.
Okay, so now let's come to, as a woman, after you've been diagnosed of cervical cancer, what are some of the things that you have to do?
So when you're diagnosed with cervical cancer, like I said, there are different stages. We have the precancerous stage and we have the invasive cancer stage. So treatment is directed to the stage at which we diagnose the cervical cancer.
Okay.
So if it's the precancerous stage, we can either do a freeze method. Yeah, we just, it's not really ice, but we call it freeze. Let me use a layman's term, freeze method to take out the abnormal cells, or we use an electric loop to take out the abnormal cells. If it gets to an invasive cancer, we could take out the cervix, depending on how far the cancer has spread, take out the cervix, then we could do a bit of radiation therapy or chemotherapy to help mop up other ones that could have spread to other parts of the body. Or we could take out the entire uterus and then still do the radiation therapy with the chemotherapy. But if it's spread to like other organs and they're showing signs that they've been infected, your kidneys are infected, your brain is gone, your lungs are down, we would have to do it. We could still go in and do the surgery, but then we'll add palliative care. Just make sure that you're dying peacefully without too many discomforts.
For the sake of some women who don't really know the difference between cervix and uterus.
Right.
So the cervix is in the uterus.
So
Like an opening.
it's an opening into the uterus.
Into the uterus. Okay, so the cervix is not your womb.
No. It's just the channel through which sperms pass into your womb.
Okay, so when you take that out, can a woman survive?
You can survive, you can still get pregnant. But that is when you need to follow through with your doctor. So that if you get pregnant and there's a need for us to go and close up your cervix, because there are conditions that some people have weak cervixes, so they haven't had any surgical procedure done, but then their cervix isn't too strong to allow a normal pregnancy. And if you don't go in to close the cervix, they could end up losing their pregnancies. In such women, we always go in and do a surgical procedure for them. Yes. So in like manner, if you're a woman who've had to tamper with your cervix because of cervical cancer related treatments, you just go back to your health practitioner.
Is that it?
No, so this is just showing, yes, this is more just around the cervix. Yeah.
Okay.
So if you've had cervical cancer related treatment, then, and we know that it could cause what we call an incompetent cervix. The cervix is not too robust to be able to handle pregnancy. We're just going and put stitches when it's time for you to deliver vaginally. Around the time when we know that the child is viable to survive outside the womb, then we just release the stitches and then you can have a baby. Okay,
so with what you're saying, so down there is where the cervix is.
And that is where you can see the cancerous tissue around that. Exactly.
Yes.
Yeah, that's
wow.
it. So you show the vagina opening into the cervix. Yes. So the cervix is not your womb, it's just the entrance
channel to get into your womb.
The vagina is the channel, the cervix is where, okay, you're welcome.
Yeah,
then
right.
You can now come in. Yeah.
But you can survive without your cervix.
Well, you can.
And you can still give birth.
You can still give birth.
Without your cervix.
So we take out the outer part.
Yeah.
I told you there are two parts of the cervix.
Yeah.
So there'll still be some remnants of the cervix left in there. Yeah.
Okay.
Don't take out everything.
So, so how do you, now, if the person, you can have it and have a baby.
Yeah.
So how wouldn't the man be affected?
How? No.
In terms of sex, if the man has to have sex, you have it, the lady has it, or this is after it's been cleared, or how?
So if the
woman has it, and the man would have to have sex before they have a baby, what's the man's protection in this case?
So if the woman has cervical, like has the HPV infection, the man is also at risk of getting the HPV infection. That's why you shouldn't say that it's not on my body, it's just on her body. if she has this and she hasn't been treated.
You already carry it.
Yeah.
So how do you have babies then? It means that you can't go close to the womb.
No, you can. So she should treat. It's a lesion,
Okay.
so she should just
After the
treat it.
treatment,
After
you can.
treatment, life still goes on.
Oh, okay.
Yeah, that's if you want to have a baby. But if you just want to have sex, you should use protection. Because you could also get penile cancer.
Baby, having a baby.
Oh, you could. You can have a baby.
Okay.
It doesn't affect the
After
baby.
the treatment.
After the treatment, yeah.
Are you okay?
Yeah. Because I'm wondering how,
You can still have a baby after the treatment. Just that you have to see your healthcare provider so that if there's a need for us to go into safeguard your cervix early to allow the baby to grow till term, we can do that while the baby's in there.
Okay, it works.
Yeah.
I'm just wondering, okay, so now sexual, intercourse, it wouldn't be compromised in any way?
No.
Or however
it wouldn't
feel?
be, but well, the woman will let you know, because I know there are some people say there are certain spots that they hit along the cervix that gives a woman pleasure.
Yeah.
So if because of the surgical procedure, it's going to be like scraped off, and so she may not have the same sensation. You as a man would have to bear with her and help her out. So you need to understand her and take her through post-treatment so she can be fine.
So we've got some responsibility, right?
Exactly. You don't leave her.
This one is up to you,
Yeah,
man.
don't run away.
Nobody's running away.
Don't run
I'm
away.
just letting them know they have responsibility. You to say we are running away.
I was just...
So, my dear man, we have responsibilities,
Yeah,
and we need to make sure that, in times like this, we're there for
the women.
our women.
Exactly.
Yeah, very, very necessary.
Dr. Eva, so what then, looking at the fact that, okay, you could take out the cervix and then still there will be childbirth and everything, or worst case scenario, you could end up taking the entire uterus and all that. What then causes the mortality rate?
So mortality in our parts of the country is late reporting, superstitious beliefs. And there are
superstitious beliefs?
Yes. So they will think that it's someone in their village who is after their lives and the reason why they are having this HPV-related infection. Or for some, they come to the hospital, we detect they have precancerous lesions of the cervix. They're supposed to follow through with treatment and they never report. So by the time they come in, they've gone to do all their herbal therapies.
Things are worse already.
Exactly. And that's actually the state of our health in this country. So they come to the hospital, we detect certain conditions, we tell them, oh, okay, run these labs and come back. And they never report. By the time they're coming back, and it's in a state that we are not magicians. There's a disease process, there's a golden hour to attend to treating conditions. So if we fail to catch you at the golden hour, treatment becomes a bit there for both sides. So some of them come in around times when there's very little we can do, and that's why we would have to go in for palliative. So we get in touch with the palliative team. It's a whole team that manages cervical cancer. So we get in touch with the team, and then they'll just try and relieve the symptoms you're having due to the HPV infection or cervical cancer.
Wow.
So if women are coming in early, we are treating early, they are getting screened.
So just do this often.
Just do it often. So I want to move a bit and talk about vaccination, because it's one thing that we should know that it helps to prevent cervical cancer greatly. Last year, Nigeria was able to, I think they vaccinated 7.7 million of their young girls between the ages of 9 and 14.
Would you not end up encouraging more sexual activities going on?
Why are we pretending? I don't want pretense.
No matter what, it will happen.
Because
it's
happening.
Yeah.
That's where I want us to move past. It's happening. Let's not be ostriches and go like, oh no, our children are holy. No, even if they are, let's still protect them.
Okay.
Because when you vaccinate a large number of young girls and boys against HPV-related infections, we know that it provides some immunity. Imagine how many 16.9 million Ghanaians are women. And let's say 10 million of them are vaccinated against HPV strains. The men are protected.
That's true.
Because it prevents the HPV strains from getting, they won't even get it, for the men to get it.
Right.
So it's not just because we want to say it would encourage promiscuity. No. When you educate someone and the person has enough knowledge about it, the person will not abuse it. How well do you educate the youngest about sex? We go, oh, it's a taboo, don't talk about it. But then they are doing it. and we are getting the effects. Or it's a taboo, don't educate them about it. But then we are seeing the signs. We have young ones, 10, getting pregnant. How are they getting pregnant?
True.
If you can empower the young ones to know and practice safe, I'm not promoting sex. I mean, I believe in celibacy and virginity, but I also don't believe I don't want to be an ostrich. I prefer to face reality for us to handle the issue and then hit it on the nail, hit it on the head.
Yeah.
So we should teach them about good and safe sexual practices, encourage them to abstain, which is it was one thing they used to teach us in SU when we were growing up. Encourage them to abstain, encourage them to use protection. I don't know how much, I'm told condom is out of stock, it's costly these days. I don't have much to say about it. Yes, that's what I hear from certain quarters. But you should encourage it. You travel out to the developed countries, you go to a pharmacy, you want to buy it, it's easy. But here, when you get there, people looking at you with some suspicious eyes, it makes it difficult for us to be able to curb the rate of spread of cervical cancer and HPV-related infections. So education, like I said, it's lifestyle. When we educate people about conditions that are lifestyle-related, we see a decrease in the burden associated with them. So we should educate the young ones. We should educate even the older ones, because some people also practice unsafe sexual stuff. Educate the young ones, and then empower people. They should seek help. The hospital is not a war zone or a death zone. They should seek help. If they have any questions or anything, they should just pass to the hospital and then ask them. Then it will move me to talk about vaccination. You know, currently WHO has a rule, the 90-70-90 rule, of which Nigeria is our sister country, and we are always, we always have this with them. So I would always use them as a case study. Nigeria has taken or handled the first part of the 90 rule. We say that girls and boys aged between 19 to 14 or pushing it to 15 should be vaccinated with HPV, the HPV vaccine. And it's very important because I think 20 years ago, US did a study. They vaccinated a large proportion of their teenage girls and boys, and now they have a reduced burden of cervical cancer or HPV-related infections in the United States. Now, so from the 19 moved to 17. Now, 70% of women, basically in the reproductive ages, 15 to 49, but I'll push from 9 to 49, should be screened against HPV strains. And then when you are screened, by age 45, you should at least have gotten some form of treatment. So if you've been screened and then after the screening, we detected that you have precancerous lesions on your cervix, you should go in for treatment. It doesn't end there. Sometimes we'll ask you to give yourself like a year for the infection to clear, but you should go for regular checkups so that if after a year it still hasn't cleared, we can provide the next line of treatment. Then we go in and then clear it once and for all. So
there's a probability that even after you have gone through the first stage of treatment, there would be something left.
No, that's so. Earlier on, I said that there are some that the body is able to clear the infection on its own.
Yes.
So for those who we give some people a room. Okay, let's say we detected some precancerous lesions on your cervix. So we're giving you up to say a year.
Okay.
Let's see if the body can clear it.
Okay.
The body is not. So after a year, you should go back. Don't sit at home and go like, oh, doctor said 1 year.
Yeah, no.
Okay. Don't sit home. Just go back and then let's recheck if the body has cleared it. If it hasn't cleared it, then we can go in and hit it out and take it from the body itself.
Oh, yeah. Okay.
So that's one approach.
Okay. All right. Okay, so I believe we have some questions. Oh, okay. So Bright says, "How is cervical cancer an infectious disease?" Just to learn. Okay.
Should I answer it now?
Yes, you may. Yes,
so it's sexually transmitted.
Yes.
Sexually transmitted infectious disease. So it falls under those conditions that we know they are infections that you get from Mpemagro. That will lead you to getting the cervical cancer in the end, basically.
That's constant bleeding. Could it lead to you getting cervical cancer?
Constant bleeding will not
maybe because you have fibroid or something, so you bleed a lot?
No.
There's no way.
No, it's not implicated at all. Yeah,
okay.
It's not implicated.
Incredible. All right.
So there's one thing too. I mean, we're encouraging people to go and get screened and all of that.
Right.
How do we manage the issue of fear when these people come and there's, the fear of being told that, okay, this is what this condition is. This is what it's going to get you
Because already when you hear the name cancer, you get
exactly,
scared.
you know. So
Okay.
how do we manage that? So when I'm also leaving there at the hospital, I'm hopeful that whatever it is, I can go, come back, and still be treated and all of that.
Okay. So fear already is not good for your immune system. Fear, stress doesn't help you. It weakens your immune system, actually. And one thing I always encourage my patients is we are not here to hasten your death process. Basically, the healthcare worker is here to kind of like slow, we would all eventually die, but we are here to slow it down. So if you could just believe that we are here to slow whatever disease condition you may have down, you could trust us along the journey and we'll take you through. Now, we are detecting this early because we want to save you, not because we want you to die early. So for starters, just know that what we are doing is to save you so that you don't die early.
Yeah, because for some people, just even announcing that means that they are about to die.
And it's also education, how well we educate. And that's why I'm so grateful to you guys for what you're doing. The Medical Women's Association of Ghana, together with Leicester, they are the ones who also push for this every month, every year in January. They go all out to looking for various platforms to help us educate the public about cervical cancer, create the awareness, let people know that it's preventable, actually. It's really preventable. Vaccination, education.
The vaccines, are they here in Ghana?
Yes, but you see, we don't have a national policy for cervical cancer in our country. So the vaccines, we are hoping that in the near future, it could be adopted and then it would help reduce the cost. So we could have a lot more women being vaccinated again.
It's a bit expensive.
It is expensive.
Okay.
I think the price ranges between 750 and like 1,000, depending on which one you'd get. And because there are 3 different types of the vaccines. There's one that is only for women, and that has like 2 to 4 HPV strains that it attacks. But that one attacks the main one that causes cervical cancer. There's one that's 4 in 1, that's for both men and women. And then there's one that's 9 in 1, that's also for both men and women. And they all offer protection to up to 10 years.
Okay.
So the fact that you've been vaccinated against cervical cancer doesn't mean you shouldn't go for screening. You should still be screened against pre-malignant lesions of the cervix. Practice safe sex. I'm so much hammering on it. Safe sex, educate as much as you can, and then also much education and also lifestyle. Smoking, this shisha and vape. I hear there's a lot of stuff going on nowadays. You are just increasing your chances and weakening your immune system in so many ways. It's sweet, enjoy the life, but remember that sometimes it comes to consequences that you don't want to know. So yeah, it's more around.
I mean, it's best you don't do it at all.
Yeah, if you can.
Because
if you can,
your health is also very important.
Very, very important. Okay, so we have a viewer from Kenya. I have a viewer from Kenya. I think he sent something, right? So Takida Kopa, following live from Mombasa, Kenya, Africa. Good morning to you. Thank you for watching. We often do get quite a number of people from different
Sierra Leone, Nigeria, Liberia.
Liberia, true.
You guys are always tuning in,
Yeah, a huge morning to you all, and we hope that you've enjoyed this conversation. Today we'll be talking about cervical cancer. It's Cervical Cancer Awareness, and our guest has been Dr. EvaVera Tetteyfio, who is a medical officer with BOB Freeman SIC Clinic. She has enlightened us a lot about cervical cancer. Stay away from unsafe sex. Unsafe sex. Stop having unsafe sex. It's very important. KMJ, stop having unsafe sex. And get tested. Get tested. If you're a woman, you know you're sexually active, kindly get tested. Doc, before you go briefly, how often should you do the testing?
Perfect. So I need to even hammer on that. So for WHO, between the ages of 21 and 29, we do what we call the pap smear test every 3 years. From 30 till 65, we do the co-testing. Co-testing is the pap smear with the HPV DNA. HPV DNA looks for the particular strain, that strains 16 and 18, which we know are implicated in cervical cancer. Now that is done every 5 years. So if you're doing the co-testing, I push for women after the age of 30 to go for co-testing. So every 5 years, you go for co-testing. Pap smear only is every 3 years.
All right.
And the centers available. Walk into any public hospital.
Is it free? It's not
I love
free.
in capital letters.
No, free
No,
lunch.
it's not free. So usually in January, I know they subsidize it for most public hospitals and some private hospitals. You could go there to get tested for cervical cancer.
Then women take advantage of this month of
my
January.
clinic, for instance, we do it all year round.
Okay.
But we are always creating awareness about.
Subsidize it.
No, we
But
don't.
Hey.
But it's all year round. It's all year round. It's all year round. So you can go to
But prioritize your life.
Yeah.
You know.
Own your health.
Yeah.
It's once a while.
Once
Once every 5 years or once every 3 years. Just invest into it and practice safe sex. Don't let the men deceive you.
Yeah.
That's if
And
it's
don't
not
let the
on.
women
If
deceive
it's
you.
not on, it's not in.
Don't
Let's
let
go
the
back to
women
that
deceive you.
campaign.
Man, don't let the women deceive you. There are women who are deceiving men out there. Do not let them deceive you.
And
If they
this
say
is
they
where-
want you, say no.
And this is where we end with this segment. My name is Asieduwaa Kumia. He is KMJ, our guest, Dr. EvaVera Tetteyfio. Doc, thank you so much. Have a lovely morning. Viewers, you can stay with us. Nathaniel Atto has all the updates in the world of
He's coming to
sports
talk
for
about
you.
AFCON.
Oh, yes, he's coming
That
to
the
talk
Black
about
Stars don't
AFCON.
know where they are going.
Yes.
Really?
Like I still support the Black Stars. I don't know what to do anymore.
Support the Black Queens.
Following.
Well, they're very good. No,
They're extremely good.
If you go to EPL, even with Chelsea, the women are doing better than
Exactly.
the men. It's like women should
Support
Doc,
the women. Stop following Black Stars. Support Black Queens. Don't support House of Folk and post-massive talk. Support Apemdakon ladies. Support those people. Stop supporting the men in any sporting activity.
Sports updates with Nathaniel Atto. We'll be right back.